This is a presentation for nurses in the Medical Oncology Unit. It is a phenomenologic approach to infection prevention and uses the patient's own words about their experiences having a port. A port is also called a permanent or tunneled central line. Occasionally, these lines are tunneled with caps outside of the skin, but really what we're talking about are central lines in which the port is implanted beneath the skin. Not all patients with ports are cancer patients. Many patients with ports have chronic illnesses like lupus or rheumatoid arthritis. They've often been dealing with their illnesses for some time. Getting a port is a sign that their illness has progressed and may become life-threatening. Not all ports are placed for medication. Some are placed because there is no other way to monitor a patient's blood work. Patients with ports expressed their fear that the port was the only option that was left to give their medication and to draw blood. Accessing a port has inherent risks. These include infection, development of a fibrin sheath, or malfunction of the port. Patients with ports can experience infiltration and extravasation, as well as necrosis of the tissue surrounding the port if complications occur. If the port is a power port or not a power port and is used for power injection, patients can also experience complications due to damage of the line itself. Another theme expressed by patients is ongoing painfulness of needle sticks. For patients with new ports, the pain may be surprising. Many nurses inform patients that this will hurt just a little, but every patient's perception of pain is different, and if the patient is anxious, the sensation of pain may be amplified. Placing an ice pack on the site is an acceptable way of helping a patient manage their pain. Failure to speak up and stop healthcare providers who have not performed hand hygiene is a theme mentioned by patients that were interviewed. Even when patients are encouraged to speak up, they want to believe that their healthcare provider has already done all that they can to protect the patient. They consider the nurse an expert, and all patients feel vulnerable and want their nurse to protect them. Speaking up occasionally causes fear of retribution, and patients have said things like, "I'm afraid that the nurse will not be as gentle with the needle," or "she'll be angry at me because I questioned his or her authority." You'll be using surfaces like the bedside table to create a sterile field. The patient may have also used that surface to eat their meal or even had a urinal sitting on it. When you enter the room before you begin the procedure, take the time to clean the surface that you will use to hold your sterile field. A hospital-approved disinfectant is appropriate to use on the surface that you will use as a sterile field. Unscramble this sentence. The power to prevent infections is in your hands. Hand hygiene is performed when you enter the room, before you ever touch the patient. It is also performed whenever you move from a dirty to a clean area. If you have to clean off the bedside table, you should perform hand hygiene after cleaning the table off. If this is an initial access, you will need to clean the patient's skin and clip excess hair. You should perform hand hygiene after you have cleaned the patient's skin, opened your sterile kit, before you don your sterile gloves. You may need to bring a small bottle of hand gel with you to do that. You should perform hand hygiene before beginning the procedure and at least once during the procedure. The nurse and the patient should mask. Ask the patient to turn their head away so that they are not breathing on the site as it is accessed. You will wear non-sterile gloves when you are pre-cleaning the skin. You will wear sterile gloves after you have opened the kit and you are prepping the skin with CHG. Chlorhexidine gluconate, or CHG, is the preferred cleansing agent. It is an antiseptic, and it's important to remember that antiseptics are applied to living tissues like skin. Disinfectants are applied to surfaces like the table. You are applying an antiseptic to the skin. All antiseptics require vigorous scrubbing to cleanse the skin and should be allowed to air dry. One of the patients interviewed had worked as a nurse. This nurse realized that pre-filled 10 cc sterile flushes are not sterile. Of course, the solution inside the syringe is sterile, but the syringe itself is packed as a clean syringe in a non-sterile wrapper. When this nurse was having their port accessed, the healthcare provider or nurse that was performing the procedure dropped the non-sterile saline flush syringes onto the sterile field. The patient realized that the whole sterile field had been contaminated. But even though this patient was a nurse, the patient did not speak up. Keep in mind that pre-filled syringes that are not included with the kit are not sterile and can contaminate your field. And as this patient perceived, not everything in a wrapper is sterile. Only things that are marked as sterile can be guaranteed to be sterile or free of all bacteria. Access needles and transparent dressings are important components of infection prevention. Depending on the size of your patient, the access needle may not be flush with the skin, and a CHG sponge will fit easily underneath it and in fact support the needle syringes. However, on a large patient, a CHG sponge under the needle may cause it to dislodge. Be certain that you assess the size of the transparent dressing. Is it large enough to stay put? Does it have a good seal around it? Is the CHG sponge causing a problem with the access? If there are any signs of infiltration or problems with the site, like swelling or heat or redness, discontinue use of the site and notify the physician. Normally, dressings are changed every 7 days, but loose or soiled dressings should be changed immediately, and you may need a larger, transparent dressing to completely cover the site. To be deemed competent, you will need to observe 2 procedures. Review the Lippincott manual. You can print a checklist, use an access kit, and perform a simulated procedure to practice. Finally, you must be observed at least twice by an approved staff person. This is usually your mentor. When you go to the Lippincott manual, use the search term implanted port access. You will be doing top access. As a confident nurse who takes the time to address the patient's concerns and relieve anxiety is a comfort to the patient. Take the time to learn your patient's story. What does their port mean to them? How did he or she feel when it was placed? How long has he or she had their port? Listening to your patient and approaching them with confidence will enhance the nurse-patient relationship. Do use the checklist that is available on the internet. You can have your mentor assist you as you move through the procedure. Remember, hand hygiene is not performed just once. It should be performed at least twice, and maybe even 3 times if you have had to clean off a bedside table. To learn more, review the infusion nursing standards that pertain to port access. Talk with your mentor about CHG sponges. Is there evidence for their use? How strong is that evidence? What type of end cap are you using? Is it positive, neutral, or negative pressure? And do you have any concerns about risks associated with end caps? What is the evidence for the use of neutral pressure end caps? Ports can be frightening for patients. They can also signify serious illnesses, but ports can also symbolize victory. For one patient, she had had her port for 15 years, and it was an important symbol of her victorious journey against ovarian cancer. The port is an important tool in maintaining health for a seriously ill person. And the nurse is the person who has much control over how the port is handled. I'd like to express my appreciation to the anonymous patients, and I'd like to recognize that the pictures in this PowerPoint are not necessarily those of the patients and are non-copyrighted pictures from this author's personal file. But there were many anonymous patients that did share their thoughts about the importance of infection prevention. Thank you for your attention. Best wishes on your role as a nurse protecting patients.